Like and subscribe to our channel, Fabulous Pattaya Media Group, by using the link below. Early this morning, Friday, the CCSA announced 14,403 new cases of COVID around the country, along with 15,610 released from care after recovery. In the same 24-hour period, 189 deaths have been attributed to the virus. Have Thai hospitals and other businesses been hacked this week by criminals in India or America? That's the question being asked amongst the cyber community this morning, as conflicting police reports over 24 hours simply don't sync. Thailand's police cybercrime unit has a lot on its hands, as the hackers have obviously used numerous VPNs before stealing data from medical facilities here, causing in most cases minor disruptions, as databases have been recovered from backup systems. With demands for money sent to many, these villains caused issues even with a kidney transplant management database. Traces left behind indicate that the first stop in the VPN trace was Singapore. However, as with the naming of India and America as the possible location of the fiends, none can be assumed to be correct, as it's just as likely that one or the other was a stepping stone in the trail which may or may not ever be traced. Use of multiple VPNs effectively tricks trackers and blocks the actual place of operation, unless the hackers are online long enough for a full trace. And sadly, all too often, they're more wily than to do that. And the information? Well, it's usually sold to create mailing lists, which are retailed to online sellers. How do they get into the networks? Well, usually a network involves multiple computers, some of which can access the internet, usually for email. One email with a fake link can, when opened, see a gateway created for malicious attacks, and that's all the criminals need to get in. Schools have been invited to apply for Sinopharm supplies from the Chonburi Royal Academy, this at no cost. The concept would see pupils of a certain age offered vaccines during school hours, similar to the vaccine programs offered in the West to pupils. Thais receiving vaccines now are seeing waiting times between vaccines significantly reduced to just 3 to 4 weeks, as the programs supply one shot of Sinovac followed by one of Astra. Despite the fact that Sinovac alone is proving to be less than effective against the Indian Delta variant, it is effective against others and, when combined with Astra, is very effective against the Delta variant too. Some see it as the first step towards the future, and like it or not, it probably is. But the Ministry of Health, together with the Civil Aviation Authority, have developed a plan to create a digital health passport for telephones, and that will show vaccination status. Its use is so far non-specific when translated, but the wording will be used for domestic flights and will be introduced soon. But the chances are that in the near future, domestic flights will be restricted to those who've had both vaccines. As the global effect of COVID expands daily and invades what was our old normal lives, so the future appears to be that without vaccines many will be shunned. Already some eateries are insisting on seeing proof of vaccines or customers taking on-the-spot tests before entry, and that number's rising. Expats should prepare too for the fact that in all likelihood at some point, vaccine proof will be a requirement for visas and extensions of stay. Like it or not, it's the way of the future globally. Strong waves are predicted for both the Andaman Sea and the Gulf of Thailand through to next week, as the current storm fronts are effectively pushed by new fronts approaching the Vietnamese coastline. Small boats have been ordered to remain on the shorelines, as waves of up to 2.5 metres in the Gulf are predicted. Meanwhile, in our own province, Chonburi this morning reported 802 new cases, 187 in Silachar, 175 in Chonburi, 104 in Banglamung, including Pattaya, and the balance around the province. 11 new deaths have been attributed to the virus here. Bangkok Pattaya Hospital is now accepting registration for vaccines via a survey form for all expats over the age of 18. Registration now is the very best way to see vaccines available in the future, as those who complete the survey won't quickly get shots, but will be added to a register, which is then used for future contacts and appointments, and also to ascertain the number of vaccines required to meet the need here. The programme will offer either Astra along with Astra or Sinovac with Astra. Those who complete the survey will receive phone calls when supplies are available. In Nuglua, a German expat yesterday barricaded himself in his own home after previously holding his daughter semi-hostage. She'd sent a message to a teacher saying that her father had gone crazy, and police were quickly at the scene. Persuaded to free his daughter, the man then locked himself in his home, set fire to it, and stood on the balcony, stabbing himself in the torso. 68-year-old Bernard Hemke suffered smoke inhalation which enabled his arrest and the removal to a medical facility. The 14-year-old girl was unharmed. A review of which provinces remain in the so-called dark red zones takes place today. Chonburi isn't likely to see a drop to lower levels, but neighbouring Rayong could well do so, as numbers there are lower. The only real benefit would be the relaxation perhaps of curfew times, as regulations even for the higher risk provinces have already been relaxed. And again, vaccinations are being given out at the indoor sports stadium on Soi Chayapruk 2 today. That's pretty much every weekday now, and no shortage of supply. And with the Met Office promising highs today of just 30 degrees dropping down to 26, an overcast day with rain. Local and national news today from Fabulous 103 FM and Fabulous Pattaya Media Group. And to get a notification every time we release another bulletin or programme,